Good afternoon. I'm actually going to talk about how we're trying to bring the evidence together from a bunch of different organizations and countries that are implementing integrated community case management in an evidence review symposium that we will be putting together. The overall objectives are to systematically review the current state of the art of ICCM implementation by bringing together researchers, donors, government implementers, and partners to review the map of the current landscape and status of evidence in key ICCM program areas in order to draw out priorities, lessons, and gaps for improving child and maternal newborn health. So there's a variety of activities that are going to be taking place to support this symposium. And I'll explain when that will be taking place. In advance of the meetings, there's going to be a series of surveys, reviews, lessons learned, and background papers on the current landscape and status of evidence in specific community case management program areas. There will be 2 pre-workshop meetings that will take place with researchers and evaluators in ICCM programs, along with key donors, to review summaries and plan the agenda for the symposium. One will follow the Global Health meeting in Ottawa in October in 2013, and that's going to be sponsored by CETA, and before the American Society of Tropical Medicine and Hygiene meeting in November in 2013, and that will be sponsored by MCHEP. Then we will have a 3-day international meeting to bring together researchers, donors, and implementers of ICCM with host country representatives, and that will be held December 4th through 6th, 2013 in Nairobi, Kenya. After, there will be some post-symposium activities, which include writing policy briefs, finalizing and disseminating lessons learned, background papers. There will be a rapporteur report from the meeting, and we're going to be putting together some key articles in a peer-reviewed journal supplement. So the way we're doing this is we are splitting the work into different thematic areas that are listed here. We're going to be looking at coordination, policy setting, and scale-up. And what we'll do is we'll document the current state of ICCM policies throughout the Africa region by doing a survey, repeating a survey that we've done in the past. We've done twice or 3 times in the past. And we have some qualitative studies that have been done looking at how policies change in each of these countries, and those will be presented as well. We're going to have a thematic area on human resources and deployment that will look at things as how to best select CHWs, training strategies, optimal ratio to household, best geographic disbursement, motivation, and retention. We have another thematic area that's supervision and performance quality that will look at things in relation to supervision as to what are the optimal strategies and methods to ensure high quality care, management of illness, what are the disease and treatments that are best covered by ICCM, what is the optimal number of services a CHW could provide, and best algorithm and use of diagnostics. We will also be looking at supply chain management, maintaining reliable supply chain, what systems ensure continuous supply, how to best forecast needs. We will also be looking at cost and cost effectiveness and financing. What are the cost drivers and cost effectiveness compared to facility care? We will also be looking at thematic area of monitoring, evaluation, and health information systems. What are the best monitoring systems? What innovations have been used? For example, to get illiterate CHWs to report, how best to integrate with the HMIS, and how to integrate monitoring results into programmatic decisions, and synthesize the process results from some of the key countries. We're going to put together some of the CREAM monitoring data that many of the NGOs have collected across the different countries. We're going to be looking also at communication and social mobilization, demand-side barriers to utilization. What facilitates families to use ICCM, and what are barriers to using ICCM. And then finally, we're going to be looking at all the impact outcome evaluations, which there are many that are coming out this year, that those that have some pre- and post-mortality, those that model like what we just saw with the Live Safe tool, and maybe we can be a little bit more systematic about how we do it across these different studies, so we're all kind of doing it the same way. And we have some that have comparison areas, some studies that don't have comparison areas, but we'll be able to look across what's happened in the ICCM programs in all the different countries and whether there's been coverage changes. And then what we need to do is relate it back to these thematic areas in the context of the country, because we will find different findings. We will find even the differences you saw here between Zambia, Uganda, and Mozambique. You will find differences, and we have to be able to explain why those differences exist. So luckily, we've had a lot of the different organizations willing to be the thematic area leads, which means that they would be leading the reviews, the lessons learned, the policy briefs, and designing the session that will be occurring in the symposium as to who will be presenting. So UNICEF's taking the lead on the coordinating policy setting and scale up. Human resources and deployment is going to be PSI. Supervision and performance quality assurance is going to be Malaria Consortium. Supply chain management is JSI. Cost and cost effectiveness and financing is Management Sciences for Health. Monitoring and evaluation, health information systems is Save the Children. Communications and social mobilization, demand-side barriers to utilization is UNICEF. And impact and outcome evaluation is going to be UNICEF's, essentially, I'll be working with the Gates Foundation. So the agenda for the symposium, there will be a session for each thematic area. And we will have some additional sessions that you haven't seen as thematic areas. And those would include including maternal newborn interventions in the ICCM, the role of the private sector, and innovations. And we will be having a tool sharing session to provide participants with all the available tools that exist to help them with their programs. So at the end, we hope that we will have a survey of the current state of ICCM, we'll have review papers, we'll have lessons learned, policy briefs, the summary of the symposium, and a peer-reviewed journal supplement. This is being funded by the Canadian International Development Agency, and we will likely get additional funds from the Bill and Melinda Gates Foundation. But what I want to say is that we are not starting from scratch. We're trying to build on the evidence and reviews that have already been conducted. And I'm just going to give some examples of what we've done in UNICEF. So we have a set of working papers in UNICEF, and we have looked at some qualitative studies to better understand barriers to care. And this is looking at Nigeria, Kenya, and Nigeria, and we've been more than happy to share that information. We've also been doing reviews of integrated community case management, and here's a few things we've done. We looked at a systematic review of strategies to increase demand, uptake, and quality of community-based diagnosis and case management of malaria. We looked at a review of the challenges for one of our biggest projects, which is the Catalytic Initiative that's been funded by CETA. And we have a summary of the survey that we did before on community case management, diarrhea, malaria, and pneumonia, looking at the policy, tracking policy. And that was a 2010 survey. We've also helped to support the supplement, the journal supplement in the American Journal of Tropical Medicine and Hygiene. And we have written a statement with WHO, and the statement presents the latest evidence for integrated community case management of childhood illnesses, describes the necessary program elements and support tools for effective implementation, and lays out actions that countries and partners can take to support the implementation of ICCM at scale. So thank you, and if you want some further information, this is my contact information. Thanks.
Thank you very much, Theresa. Okay, Eleni, any questions? Any questions, points of clarification from participants? Yes, Claire?
Thanks, Theresa. I guess just a clarification question, really, but obviously there's an enormous amount of work being done across those thematic areas. How do you intend to bring those all together and synthesize them?
As I already said, we'll have review papers in each of the areas. We're going to have lessons learned documented as well in a template, in a specific format. We will have sessions in each of the thematic areas as part of the symposium, and then we will also have policy briefs for each of the thematic areas, and we will have a peer-reviewed journal supplement to bring it all together.
So I guess that it relies on people coming to the workshops themselves. If there's a lot of organizations or people who are doing, universities who may be doing some interesting things which are very relevant, is it possible to contribute without coming to the workshops?
Yes, it is. It's very possible. What I'm relying on is that the lead of the thematic area is canvassing everything that's out there. So that's part of their responsibility. So right now we try to collect as much as we knew based on the different NGOs and universities that we knew, and we put them all on a table right now. So in each thematic area I actually have a lot more information. But I'm expecting the leads to be able to canvass and bring in as much information as they can possibly bring in.
Thank you. Yes, the gentleman from Save the Children and then PSI. And then
Thanks, Theresa. I think when Jeffrey was talking about all the statistics, I was wondering, this is probably the fourth time I'm in such a meeting for a catalytic initiative program. So I think you've probably answered the question that you're going to sum up everything. But every one of these organizations, the members of that consortium, have had their own synthesis of the last 6 years of implementation, and some of it has been published. Like for IRC, they've published in the American Journal, Save the Children has it as well. And so I think most of it is still grey literature, so it would be really useful if that comes out as part of this review. Okay.
That's what the plan is.
One of the requests, I think, you talked about costs and financing, and I think it would be very useful if we could somehow factor in the cost of coping with illness. So it's something from a child's perspective, something from the family's perspective in terms of seeking care. We talk about the costs from the supplier's side or the drug procurement or supply side, but we probably ignore the cost from the family's perspective. It would be very useful to come up with something on that.
I will let that thematic area lead. I will make them aware of that.
Thanks. Thanks, Theresa. Really, really interesting and also really exciting, I think, what's going on. It's really encouraging to see all this information being pulled together. So my question is kind of the next step beyond that. Where do we go from there? Because where does the connection happen with the ministries to get them really interested in this kind of thing? Things like, I'm thinking of the Sun movement in nutrition or rollback malaria. Do you think that it's feasible that we could see some kind of established movement for ICCM moving forwards? Is that something that UNICEF are looking at?
I'm open to any suggestions whatsoever. What I'm trying to we're trying to figure out who are going to be the participants in the meeting, who else we should be inviting, and so forth. And I'm really open to any suggestions whatsoever. The idea now is to be able to close the conference talking about all that. How do we sustain it? How do we engage all the community? And we're hoping to have from each of the countries, we made a whole list of countries of those who have ICCM and those that could use ICCM in the Africa region. And we're hoping that we're going to try to make a list of who we think the types of people that should be coming from each of these countries, and hopefully we'll be able to organize that. And we are trying to invite some folks from other parts of the world who have very stellar programs that could be able to present to the African region. But any ideas that people have of who should be invited, whether there should be another roundtable or any other things like that, I'm more than open to that, because we're just at the beginning. We really haven't planned the agenda right now.
yes, Anne-Marie.
Thank you. Sorry, I think probably just a follow-up to that. Obviously, the policy briefs that you're talking about, are they going to be fairly technical policy briefs, or are you looking at potentially having some sort of top-line summaries that could be used for advocacy purposes, just to make it quite simple for policymakers?
It's to make it simple for policymakers. That's why the policy briefs, which was the insistence actually of CETA to have policy briefs coming out of the thematic areas. It doesn't mean that every thematic area has to have a policy brief, and it doesn't mean that one thematic area can only have one policy brief. But it's like the key things to make it very simple for policymakers or people who are going to finance or ministries so they can move forward with these programs.
Okay, thank you very much, Theresa. We'll now take a 10-minute break, and then we'll go on to the next set of presentations. So a 10-minute break, and please come back